I love being able to do stories that can directly impact our viewers. And no one really wants to be in a situation where they have to visit an emergency room. But let's be honest, sometimes that just is necessary. And I am so excited to learn more about Guidewell. My new friend, Dr. Mike, here is with us to break down the differences between Guidewell ERs and maybe some emergency rooms that we're familiar with in the past. Dr. Mike, first off, thanks for having us out here. How are you?
How are you doing?
Well, I got to tell you, the location, number one, is fabulous here. I mean, you've got a great facility right on Dale Mabry, which is a busy area, but a standalone emergency room. How does this differ from the other emergency rooms of the past?
So Guidewell, the approach they take is very different. What patients in Tampa are seeing is an evolution in medical care. What our approach is at Guidewell and makes it special is that it's patient-centric, it's cost-effective, and efficient. And, I've been practicing emergency medicine for over 20 years through 6 states. So I have some experience as a board-certified emergency medicine physician.
Let's talk a little bit about expanding on the services. I mean, with your background in emergency or medical care, I know you've seen the gamut, and it seems like here you also treat the gamut.
Yes, we do. From ankle sprains to strokes and heart attacks, we do treat everything you would see in a regular emergency department. But what sets Guidewell apart, and let me give you an example. Say you go to the ER and you fall, you break your wrist. You wait hours in the ER to be seen. You get seen, you get splinted. You get a piece of paper that says, hey, you need to follow up an orthopedic doctor. You're provided a doctor that may not be on your plan, may not be able to see you, may not even be in your area. And then you're told to come back in 2 days to get copies of your x-rays because they're not ready yet. And the patient is just kind of in limbo. Now, if you come into a Guidewell facility, you're greeted right away. You're placed into a room rapidly. You're assessed by a provider. We do the x-rays, we splint you. But when you leave, our care team finds an orthopedic doctor on your plan, close to your home, and that can see you in the time frame you need to be seen. And that's where the efficiency of the healthcare comes in.
I like how you say the efficiency there, because my mind went to the efficiency when it comes to the time of waiting. That's what I initially thought of too, and you can tell that the patient focus is key to be able to find that follow-up provider. But being able to have rooms like this and what we're sitting in, I mean, what do you hear about the feedback as far as the time waiting? Because I know that's one thing personally in my family that is something you dread with the emergency room.
Well, yes, and I think when you look at patient satisfaction scores in the emergency room, being a medical director for years, it's all about the wait.
Yeah, it is.
It's all about the wait. And unfortunately, the way that the nursing staffing is, people wait hours and hours in the emergency room. But not only that, you get home and you get hit with a big bill. I mean, you got to pay the hospital fee. You got to pay the ER doctor fee. You got to pay the radiology fee. Whereas if you come into Guidewell with no insurance, to get the same kind of care and an orthopedic referral, probably around $250. Compared to like a $3,000 or $4,000 bill from a hospital.
What if you do see those patients that do need to take a step further and be admitted into a hospital? Do you have the relationships with the hospital that can also be done in the future if necessary?
Yes, so we evaluate patients, and if you need to be admitted, we have the patients choose whatever hospital that their doctors are affiliated with or wherever they want to go. We arrange transport and we transfer them to the facility. But our goal is to keep people out of the hospital. So if you have something simple like a pneumonia, dehydration, we'll hydrate you up, we'll give you IV antibiotics, and then we'll have you come back the next day and keep on treating you and try to keep you out of the hospital.
What about migraines, Doc? I'm not asking for personal reasons at all.
We treat migraines too. But our focus is on the patient, and that's why this makes this care model very efficient, very special, and I think hopefully this will spread throughout the country, what we're doing here.
I like how you say care model, patients first. I think these are really important things that you want to see happening in the world of medicine. Well, do me a favor. We're going to get ready and say goodbye. How many different locations are there in the Bay Area? I know you've got what?
There's 7.
Okay.
There's 7 in the area here. There's several here. There's on Dale Mabry, there's 2. We have one in Palm Harbor, St. Pete, Largo, and also one in Tampa.
Good stuff. Well, I'm sure glad you invited us to this one here on Dale Mabry. Dr. Mike, it was nice to talk with you today. And as always, you can check out the Guidewell website for more information, or always find even more information at tvmorningblend.com.